A 48-year-old female with fever since 2 days and the diagnosis of acute cholecystitis with cholelithiasis came to us and was posted for laparoscopic cholecystectomy. As you can see here, the gallbladder fossa was covered by omentum and the gallbladder is surrounded by pus flakes and toxic fluid all around it. A needle was introduced in order to suck out the purulent fluid within the gallbladder. As this was done, the gallbladder collapsed and thus helping in dissection. Using the bipolar forceps, blunt dissection was carried out, making sure that no injury happens to the cystic duct or the common bile duct. Slowly and steadily, planes were created and then further dissection was carried out. Using a suction, the surrounding fluid and the blood clots were sucked out. Considering the difficulty of the case, a fundus first approach was used and the gallbladder was separated from the gallbladder fossa. By doing this, the cystic duct can be readily identified. As expected, there was bleeding from the gallbladder bed, that is from the liver, which was then coagulated using bipolar energy as well as monopolar energy. After the coagulation, the cystic duct could be easily identified and this cystic duct was then clipped using Liga clip 300. The specimen was then cut towards the specimen side after application of 2 Liga clips and the gallbladder specimen was extracted out from one of the ports. After this, copious irrigation was done with warm saline and this fluid was then suctioned. Thus, a good peritoneal lavage was given. A drain was then placed and the surgery was thus completed. This is the specimen. Thank you.